Hello, I am here to demonstrate the setup of the J0470M ElectroSurge unit from Jorvet. The unit itself comes with everything you need to get started. It has the unit, it has a foot pedal, a power cord, a handpiece, 7 set of electrodes, and the grounding plate. The grounding plate on this is stainless steel, therefore you do need conductive gel. Ideally, ultrasound gel works great. It needs to be put on the plate, so just make sure the foot pedal is plugged in the back of the unit. You can put some gel on the plate here. It doesn't have to be much, but it needs to be on there and it needs to be dispersed along the plate. So just a thin layer is plenty. You have to test the unit out on some form of tissue. If you just turn it on and try to use it, it's not going to do anything. It has to actually have a ground. So the grounding plate gets plugged in. The red cord matches the red outlet, so that goes in there. The handpiece, the black plug goes in the black outlet, so they're color coordinated. And then you'll also notice this handpiece has a green cord. The electrodes are green, so therefore you use those. You pick out electrode. The electrode just pushes directly into the handpiece. If you want to change out the electrode, you then pull it out and put another one. Push it in just until it's snug. We are going to use a piece of chicken for this demonstration, since I don't have a live patient. So the chicken would just sit on the grounding plate. That should be enough to ground it. Go ahead and turn the unit on. So you have 3 settings. You have cut, coag 1, and coag 2. Cutting is full cutting mode. Coag 1 does cut with some coagulation of smaller vessels, and coag 2 does cutting with coagulation of larger vessels. So ideally you want to start at a fairly low setting when you do this and then work your way up. So we're going to start at 4 on the cut mode, and then you just push your pedal and it should cut. You can see it cutting right there. It cuts pretty smooth. If it does have drag, then you might just turn it up a notch or 2. See how that does. I think that's a little bit smoother, but it throws some smoke, so it may be a little too high. If you go again, it's pretty smooth. You can then adjust to the coag 1 mode or the coag 2 mode, and it should have fairly similar properties to it. When you do press on the pedal, you'll notice the active light lights up here. That means that it is well grounded and it will work. They recommend that you don't ever run this unit at 10 full blast because it will wear out the components of the unit. When you are done with your surgery, you can just shut the unit off. You can take the electrode out. You can scrub it up to get the tissue off. You can autoclave both the handpiece and electrodes at 250 degrees for 10 to 15 minutes. That should sterilize them for you. And then you just remove the plate out from under the patient that it's under, and then you can wipe that off with just disinfectant or soap and water, whatever you typically use. And then you can store your stuff away. When you're wrapping up the cord, try not to kink it because that will break down the cables, and that can affect down the road like what your contact is with the plate. Thank you.